I just want to understand though, Dr. Ballal, in terms of sequencing, in your hospitals, is there a sequencing that you've gone that the more elderly among your doctors or health workers get it first and then the younger doctors? Is there a sequencing that you intend to do?
No, there's no sequencing. What we will be doing is we have 4,000 plus employees registered in our main hospital. And as per the rules of the government, we are going to set up about 42 centers or 42 booths so that we can cover about 100 patients a day, which would cover almost our entire staffing in about a day. But there won't be any preference for young, old, ladies, men, nothing. It will be according to the booths that you're allocated in. There may be a booth for doctors, one for nurses, one for paramedical personnel, but that will be the only differentiation. And that's a matter of logistics, not really a preference to anyone or not. One more thing I'd like to say, Rajdeep, as much as we respect everyone's opinion, I do believe that people should be vaccinated, irrespective of whether they've had COVID or not. It would be almost impossible to check everyone for a COVID antibody. I have seen hundreds of patients who have had COVID and the antibodies just disappear, and we cannot do complex T-cell immunity tests. So I think in a mass campaign like this, it would be impossible and maybe a waste of money and energy and losing your focus if you try to do an antibody test and then selectively vaccinate someone who does not have the antibodies. Please vaccinate everyone. The government has taken the right policy and we should go.
Dr. Sarkar, do you also agree that the policy that the government has taken is step by step, health workers first, then the other frontline workers, then you go to the elderly, and then you move to those with comorbidity? The sequencing is important in your view, Dr. Sarkar?
Yeah, of course it is, Rajdeep. But I think even within healthcare, we have to prioritize people with their chances or the probability of getting exposed. So without a doubt, people who work in critical care, anesthesia, invasive specialties, who are coming into close, intimate contact with patients, all kinds of healthcare workers will have to be given preference, and the rest will follow. Because, today is also a day when we remember more than 1,000 odd healthcare workers, which includes more than 500 doctors who have fallen to this pandemic. So I think preference will have to be have scaled depending upon the probability of getting exposed. These people will have to get vaccinated first. Right. And if I may, Dr. Agarwal made a very important point, but perhaps in this huge mass of data that we have, one data that is missing, which we only have in patches, which is a formative sero survey of India. Because a substantial, robust sero survey to give us an insight, yes, from Dr. Agarwal said, we do believe that we have a detected is to incipient ratio of 50:1, which makes about half the country affected. But a lot of that is based on presumption and very small sample sizes. So probably that is right, but by this time, we would have expected our ICMR and other authorities.
Sure, but I'm getting a sense that irrespective of the sero survey data, most of you are saying we must still go ahead with the vaccination drive. Dr. Subramaniam Swaminathan, in a sense, therefore, even though, as you said, some of your colleagues have misgivings in your hospital about the data available on the vaccination, the sense one is getting is that given all that has happened over the last 9 months, the vaccination is seen as a step forward in at least restoring confidence among health workers on the front line.
Absolutely. See, the concept of vaccination is not being debated at all. Everybody agrees that a good vaccine is the best weapon in our armamentarium to keep us safe. And like everybody has said, looking at antibodies does not necessarily make sense, because B-cell immunity, which is antibody, which will wane over time, is not a very good protection. As somebody said, it's going to take a long time for us to vaccinate everybody. So even those who have antibodies only and no T-cell immunity will become vulnerable even before the exercise is over. So for that reason, we need to have a system by which even the T-cell is challenged. And to me, the vaccine makes more sense. So therefore, I don't think there's a question of looking at antibodies at all. We just need to go ahead and vaccinate everybody. But the concern is that how do we make it acceptable to everybody? Like somebody has pointed out, there's already a lot of data. If you look at what every country has done, when they rolled out the vaccination campaign, they succinctly summarized all the data that's available to date and put it in a way that people can easily understand. And I think that's where we missed a trick. We should have collated all the data from all the centers that have used any of these vaccines and said, see, this is the number of people who have been vaccinated, these are the kind of side effects we have seen, and this is how safe it is. That would have made for a huge soundbite as compared to the deafening silence that we are hearing right now.